Today we are going to discuss about a randomized pilot study of the efficacy and safety of loading ticagrelor in acute ischemic stroke. Ticagrelor is one of the most recent antiplatelet drugs to be approved to treat ischemic heart disease. Its efficacy may exceed aspirin in improving clinical outcomes in patients with acute ischemic stroke who are ineligible for recombinant tissue plasminogen activator. This study evaluated the safety regarding hemorrhagic complications as a primary endpoint and the efficacy as a secondary endpoint for a 180 mg loading dose of ticagrelor within 9 hours from the onset of the first ever non-cardioembolic ischemic stroke. This study included patients aged 18 to 75 years who presented with their first clinically manifested non-cardioembolic ischemic stroke. Eligible patients randomly received ticagrelor or aspirin loading and maintenance doses. Screening, randomization, and initiation of treatment all occurred within the first 9 hours of stroke onset. A total of 85 patients received ticagrelor and 84 patients received aspirin. The patients who received ticagrelor had a better clinical outcome in terms of NIHSS improvement at 2 days and 1 week of discharge, and a favorable MRS score after 1 week of discharge and at 90-day follow-up. There was no significant difference between the two groups regarding hemorrhagic adverse effects. Coming to the conclusion of the study found that ticagrelor had a better clinical outcome than aspirin based on NIHSS and MRS in acute ischemic stroke patients who received it within 9 hours from symptom onset and had a shorter hospital stay duration. It was also found that ticagrelor was non-inferior to aspirin regarding hemorrhagic complications.